Good morning, everyone. This is Fran Lewis. This is MJ Network, in memory of my sister Marcia Joyce that set me on this path. Dr. Tawana Houston is here, and she's a naturopathic doctor. I read it, and this question I wrote this morning. I sort of added it in. Let me put the reading glasses on. I am so excited. This is so different than reading about a book. This is important, and I think people need to know that this book is there to help them. Too bad I grew up in the South Bronx. Too bad it wasn't there for my friends when I was growing up. The summary of the book and why did Jesus write? How does the information in part one define the meaning of the title, which is Black Wellness Barriers? How did you come up with that?
Well, I thought about uh, my experience as a naturopathic physician in addition to my lived Black experience. And I wanted to just understand what is really going on with our health issues in the Black community. And that title just kind of encapsulates it in a very concise way of there's barriers that exist to our wellness.
It really says a lot, let me tell you. And when I'm done with this, I'm posting it everywhere. I mean, if you're going to get, I post things on LinkedIn, and like 5 minutes after, people get hundreds of views. I'm like
Okay.
impressed with my impressed. So, Dr. Chawani is a licensed doctor and cultural wellness that uncovers the deep roots of black health disparities in America. That is so true. And if you listen to the news, it's still true. Blending historical research, public health insight, and holistic healing wisdom, she reveals how centuries of systematic racism have left biological imprints that still shape our physical and mental well being today. And if you listen to the news with what's going on with the SNAP and all of that in New York, these people need they need their food.
Yeah. Yeah.
I know. So
Absolutely.
yeah, it's sad. So question one is what are the major four parts? We know that. How would you define part one? Historical foundation of dehumanization. That's a powerful chapter.
Uh, yes. The historical piece that I talk about in the book in part one is, of course, just
Yeah.
opening it up with just the understanding of the beginning of the social racism, race as a social construct, in terms of just the division between oppressed Europeans and people of African descent, whether they were enslaved or free at that time, and just this elite plan of white superiority versus black inferiority. And so taking that understanding and how it helped to keep this whole system of dehumanization
Yeah.
in within the enslaved blacks, because if you see someone equal as you, there's no way that that could have endured for as long as it did. But when one is dehumanization, erases compassion. It erases a sense of people being deserving of rights and privileges and so forth. And so that was dismantled among society. And so, in understanding that, you see this
Yeah.
extended period over hundreds of years of people being physically through nutrition, just the amount of uh, demanding labor that was required of the enslaved, and the inadequate nutrition from quality of nutrition in addition to quantity. By some historians, I mean, there's some differing opinions on that, but definitely the quality of the nutrition was not in place. And we see that in terms of just the impact that that had on their health, in addition to the psychological dehumanization. And that has been just so impactful and so long-standing in terms of you take a whole nation of people and you strip them of everything about their identity. And identity is such a huge part of who we are as a
Uh
people.
huh.
Our culture, their sense of understanding of the divine, their names which carry meaning, their various cultural practices and customs. All of that was stripped in addition to their autonomy. Their own bodies did not belong to them. Nothing about their lives belonged to them. And so it was just this physical um, physical enslavement, but also just a psychological one as well because of who they had to become internally to even uh, the who they had to become internally to withstand those conditions for the sake of survival. And that is just the overarching understanding of what that part of the book discusses.
I know. I went through that, and I'm telling you, yeah, my doctor yelled at me yesterday. I weigh 93 pounds, but it's a long story. And he said, you need to eat more of this, more of that, more of that. So I read the last part of your book about nutrients and nutrition because there are certain foods I'm allergic to that I can't eat,
Hmm.
like eggs, egg
Hmm.
whites, wheat.
Yeah.
But I said, you know, where do people go? I mean, this book can help so many people live, not only black people, white people,
Mhm.
everybody.
Yeah. Yeah, yeah, it's definitely a book that can be beneficial to everyone to learn from, as well as, all
Yeah,
of the resources that I place in part four of the book. It is tools for everyone. It's, of course, written to the Black population, but it's tools that can be applied uh, that are not race binding, basically.
I always had a weight problem, not anymore. I weigh 200 pounds a
Hmm.
long time ago, so learning how to eat properly is hard. And you really need to have somebody guide you so that you don't starve, but that you eat properly and you lose weight, but not 20 pounds in a week, like a
Right,
couple of told me
right.
about it.
Yeah,
So,
yeah. Nutrition is definitely at the bedrock of our whole health
yeah,
because that's the driving energy source, and
yeah,
that's not how we treat it. Unfortunately, it's like we treat it as something social, as something
yeah,
fun, as something full of comfort, but not necessarily about nutrition that is fueling our cells so that we can live a productive life doing what we need to do day to day.
yeah.
But society doesn't make that easy either. It's so commercial and capitalized that
I
it
know.
the health of people is not of central importance when it comes to nutrition in this country.
You should see my portions. So, number part two. The second part is what are the 10 structural barriers to wellness? And could you define three of them? That really got me, that there were so many.
Yeah, those are just the ones I list in the
Yeah,
book. I didn't want to make 1,000-page book, so I had to condense
yeah,
it down to what people might actually be willing to read. But I did try to pick out the most things that I felt the most important in terms of more of just a focus around the social determinants
mm,
of health. And within those barriers, the list of those would be housing, education, food access, healthcare, transportation, environmental, safety, and social identity. And I feel like, labor and social
yeah.
economic. And so I would say the top three for those brands, I I'm going to pick out the ones that there's a lot of intersectionality
Yeah.
with the different barriers, and so housing intersects with so many of
Yep.
the other barriers because zip code is very important. Where you live is going to determine so much about your quality of life, not just the peacefulness or the aesthetics of your home environment, but also the aesthetics of your neighborhood, what type of resources that you need day to day for life are easily accessible within your neighborhood, such as food access. We see so many more. Food swamps within the Black community, where there's 2.4 more times fast food restaurants than in comparison to white communities. And then which means that it's usually a food desert where there is not any grocery stores within a 1 to 2 mile radius, and so people are having to utilize other means to get further away to access something that should be at their readily disposal. And so that becomes a problem in addition to housing. uh, there's the infrastructure of, are there sidewalks for people to walk safely? Is there parks and green space that are nearby for people to walk to and just enjoy the green space and all of the therapeutic benefits that come with being in that space, like just an elevation of mood. And so when we consider also, there's social economic status disadvantage as one of the key barriers that intersect with everything as well. And with social economics, there is just when we look at the period of enslavement, I don't think, Fran, there has ever been
Yeah.
any business or industry that has had the same level of return on investment as the period of enslavement. Because when you look at it, there are over $14 trillion in wages,
You
$14
know,
trillion in wages
yep.
that were not paid, not paid.
Today, yeah, they're not paying a lot of them today too.
Yeah, yes, yes. But I mean, I would say that's a significant head
Not
start.
fair, yeah. You know what it is? They judge you where you live. They judge you by what you look at, what you look like, and that's wrong. Even even going into unemployment, because I had to do it for my mother a long time ago, and I had to pretend to be her, which is hard when you're not 80. But they judge you where you live. And when I tell somebody I grew up in the South Bronx, which I did, in a tough building on Southern Boulevard in Tremont, they look at me like, oh. I go, oh, I will bet you couldn't do it. I bet you wouldn't survive. And you know what? It never dawned on me that it was dangerous. It was. It was very dangerous, but it didn't matter. I just walked and I just held my head up and I was tough. And you know what? It was the best thing that ever happened to me. Except the
Mhm.
building I
Yeah.
live in was not very safe, but I learned to walk 12 places up and down. But yeah, you know what? You go up in the South Bronx and go to school in the Bronx, and you know what? You're much tougher than most people. And you
Hmm.
understand other people too. And that's the problem. They judge you by what you look like and what you live, and that's wrong. So now we're going to come to part three and four. Oh, this is even better. What is the biology of oppression? And part four, extensive reclaiming black wellness. That's hard.
The biology of oppression, Fran, is
Yeah,
the day to day lived Black experience, and being in an environment where one is encountering chronic stress triggers, and that is when the body perceives a threat,
yeah,
whether it's real or imagined. And there is a whole cascade of physiological responses that the body goes through to manage that threat. And so there's particularly the release of cortisol and adrenaline. And when those are released, the body is going to go into the sympathetic nervous system response of just an accelerated heart rate. We see African Americans leading in hypertension, cardiovascular disease, and there's going to be this flood of glucose as a resource because with the sympathetic nervous system response, the body is going into fight or flight mode. So whether you're sitting at work or in your car and experiencing the stressor,
Uh-huh.
you're not running, you're not fighting, but your body is reacting as though you are. And so this glucose as a resource is being released, but it's not being utilized. And so
Yeah.
we see uh, 40% of African Americans are dying from diabetes. And so this is all of these things are contributing to the chronic disease prevalency and that we see within the Black community because of just the chronic levels of stress that
Mm.
is happening within the body.
I know because stress can bring on us osteoporosis. It can bring on diabetes. I know it can do a lot. My niece has diabetes too, and when she gets stressed out, she winds up having to take more insulin, and
Mhm.
that's not great. Yeah,
Yeah, because
it does affect you. I know.
the glucose is elevating when you get
Yeah,
stressed out, and then
tell me about it. I
yeah.
have no feeling on the left side of my face from a surgery. Somebody made a mistake and never told me I had a growth in my jaw for 12 years. So when they took it out, he moved my face, he moved my jaw. I'm just lucky I could even chew a food. But at times it gets to the point where you get up in the morning and you can't function.
Mhm,
And I don't like taking pills. So I take a hot clot, the cold clot. But there are people that are in a lot of pain and wind up with opiates and
mhm,
wind up taking really bad stuff that they shouldn't take. And trust me, you don't want to do that. If you could live without the pills, that's even better. But I know it's hard for somebody with diabetes. They have to take the insulin. So what
mhm,
bothers me is that my niece takes it, but at one point she was having trouble getting it.
mhm.
And they're
Yeah,
raising the prices of all of it now. So she
yeah,
takes a certain amount every month, where it was 35, and that was over $100 a month.
yeah. It's pricing people
So what
out,
do
and
people do if they can't afford it? Do they
uh,
get subsistence? Are they going to get subsidy? Are they going to get some help? It bothers me when people can't afford to pay for something. So I know how it feels.
yeah, and that's what another barrier that I list in my book, Black Wellness Barriers,
Yeah.
is the healthcare access, because you have a significant percentage of African Americans that are working service level jobs that don't necessarily provide healthcare insurance, and the majority of people that have insurance, it's coming from their employers, coming through their employers, and so that limits access. In addition, those that do have insurance or are able to go to the doctor, other barriers to access is what happens during the clinical encounter. Uh,
Yeah.
as far as their pain being dismissed, their pain not being managed at the same level as their white counterparts, even when they're being treated for the same condition, whether it's a bone fracture or appendicitis in Black children versus white children, they are not given the same level of pain management. And so you have
It's
these
sad.
clinicians, yeah, going into these clinical encounters with implicit bias and therefore not building rapport with their patients. And unmanaged pain can cause a lot more health complications and deterioration of quality of life. And then you can't access the meds either um, due to financial challenges and things of that nature, in addition to physicians not providing any type of referrals or opinions, second opinions, and things, conditions being missed or misdiagnosed and so forth. And so you have all of these different things going on in terms of the healthcare system, and that creates barriers to access for African Americans to receive the proper treatment and evaluation to help improve their health.
I agree. Not only that, but I taught in public school in the Bronx for 37 years in a tough school on Fish and Needham Avenue. I loved every minute of it. I never
Mm,
had a problem. But what I noticed was that the kids um, were no free lunch. And when they tried to deny them the free lunch, I figured out a way for them to get it on me.
mm.
There were a couple of parents that they said were over the guideline for funds and stuff,
Overqualified,
maybe a
yes.
dollar or two. And the kids would come saying they wouldn't give me, I bought them the free lunch. There was
Mm,
no, I had lunch duty twice a week. That was my nightmare for the week. 500 kids and me. And they listened.
mm,
And I said to them, no one's going to starve in this lunchroom. I'll do without something before I'll have my children do without. And these were second graders to fifth graders. Because you imagine them in the same lunchroom, 500 of them. And I
mhm,
would look at them and they would say, and I would, they listened. Because
mm,
namely at the end of the month, I used to get myself in trouble because I would say the best class is going to get a reward. It was 23 classes. I had to buy 23 packages of cookies. For, for real, one for every class. There was never a class that got in trouble. And I said, if one child gets in trouble, your class doesn't get it. They wouldn't even think about it. And they're all on Facebook, so I know I did a good job. And they're all not that much younger than me. They're in their 50s, and they tell me I tortured them to become somebody that's really special. So
mhm,
kids in school today, I don't know if they get the proper meals.
mm.
I don't know what
Yeah.
they. I know my friend works in my school. I got invited back to come in for career day, but I have to think about it. And I said, then it's not the same. The principal's brand new. The teachers, there's 12 new teachers, and they're not trained. And I don't know what they get in the lunchroom. She said sometimes she actually has to buy them the lunch because basically back then when I taught, the lunchroom people, I would go in and I would say, what are you serving? No, you're not serving that. You're going to serve this because it's healthy. But it's sad. So an interesting question. What truly makes you sick? Um, how do you transform? How did people transform? To reclaim your wellness as a birthright, not a privilege. And it is your right to get the proper care. And I growing up in the South Bronx, I went to a doctor's office that never took money from anybody. Dr.
Mm,
Ballard just said, a dollar, $2, whatever. It didn't care who you were, but everyone was treated the same way, sort of, if you know what I mean. And
mhm,
I just feel that even when I walk in to an urgent care or a medical office, people get treated differently. Why? Why? I resent that. They look at different people, or as an educator, I know more than whatever. And I just say, hi, it's me. Sometimes they resent when you know too much and ask too much questions. How do you deal with that when people walk in and just ask for help and they don't get treated the right way?
yeah, I mean, that's one of the biggest challenges with the
Yeah,
healthcare industry right now. It's like
yeah,
when people are in pain, they're at their most vulnerable.
yeah,
And with the Black community, there is a significant level of distrust with the medical
yeah.
complex, and justifiably so, just based on our history with medical providers.
Yeah.
And so it's very unfortunate that pain is being dismissed. Health concerns are not being heard. And so people are being treated like they don't matter, and they're being undervalued for who they are, and everything. And so we see a whole cascade of events happening as a result of that, with just the unmanaged pain and care, as I was speaking of earlier.
My favorite is Element is number four, but we'll get to that in just a minute. Um, this is really one of the most powerful books I've read. But before I forget, next week on the 13th, the author of Selected Meanderings, she comes up with things that she did that were wrong and how she got away with them. It's hilarious, kind of over the top. Now, on the 17th, I am so honored. New York Times author Philip Margolin will be here with False Witness. On the 18th, Jane Ann Krantz will be here with the shop on Hidden Lane. The book is announced. She actually had to print it out for me so that I could do the interview because the book's not coming out till January, and she wants her interview next week. And on the 25th, the number one author in the world in England, Peter James. Hawk is dead with Queen Camilla. She might actually come on. I don't know. That'll be kind of like really wild. And if anybody has anything they want in December, I might take. I have some in January too. And I thought about retiring, but they're not letting me from doing this. This has been like when I retired from teaching, I didn't know what I was going to do. And I'm so glad that my sister told me to do this. She said, "Why don't you write a book?" Which, of course, I did, which was her downfall. And now doing this, when Blog Talk went down, I didn't know if I could do Restream because, look, seeing the person, but it makes it easier to get to know you better, get
Mhm.
to understand what you did. Now, Element 12 is the most powerful one of all. On Element 12, this one I think strikes home with a lot of people, and that would be stress management and cultivating calm in a chaotic world. And Element 12, connection, building belonging, and safe place. Some people move no matter where they move, and I know that you move from one place to another, and you're new there, and they make you feel like you're an outcast,
Mhm.
and that's hard. But elemental level is the most important one I think for people. How do you stress management, cultivating calmness in a safe world? Because there are so many people that like this. I see them in the street like this.
Yeah. High anxiety. Um,
It's hard.
well, cultivating calmness comes from within.
Yeah.
I mean, we can live in a chaotic world and understand that we don't have to tap into that energy. But it definitely requires a lot of intentionality, which one of the strongest stress mitigators with science backs is in terms of meditation. Just the art of being still, the art of mindfulness, the art of being in silence. And that's when we are able to recalibrate and tap into energy, internal energy within us to strengthen us and to help us not so easily be knocked off of our center when we are interacting in a world that is causing us a more elevated stress response. And so it's not to say that we don't react, but our ability to pull back from it becomes a lot faster when we're doing practices on our own daily, regularly, frequently to help to center ourselves.
Now this one also bothers me too. A lot of people don't understand the diseases. They don't understand that kids need to be vaccinated for measles, rubella, and chicken. All the not chicken pox. Chicken pox. I had chicken pox. That was fun. Measles and rubella, and that's hard. MMR, and they don't. Some people don't feel that they need to be immunized. Even them. And in the schools, basically in New York City, they have to be vaccinated, but yet you can opt out of it. That's a tough one. You knew you. So how do you prevent taking charge before disease takes hold? I know that you go into a doctor's office and they tell you you have hypertension, you have this, you have that. When I get upset and the doctor tells me something I don't want to hear, well, I'm not sick, I'm fine. He'll say, well, just take this. I close my eyes and I think about something beautiful. I think about a tree or something, and I think about something that my sister used to play on me, which is fun. I think about something that could help somebody. My nieces are all in their 29s and 30s, and they call me up, text me every day to see what mischief I'm up to, which is really great because when they have a problem, they call me too. Makes me forget. But I find that if you close your eyes and don't think about it, in about a minute it goes away.
Mhm.
So how do you teach people like that? Because I worry that there's been a lot of suicides on the news, a lot of people killing people for no reason, a lot of people not able to get the care that they need. I mean, went into the emergency room 2 weeks ago for something, nothing major, that they needed to check because of my surgery, and I noticed that they treat people differently. They know who I am and they know what I do. They know I have a show, so I get treated differently. Yet other people come in and they go in there, and I say to them, "You need to treat everybody the same because it's wrong, especially in a hospital." And I see it. I mean, they're nice people, but if they get this attitude problem, how do you change that? Because everybody's equal as far as I'm concerned, and I don't think anybody's better than anybody else.
Well, I did serve as a on adjunct faculty at a medical
Yeah,
school where I taught a lecture series
yeah,
um, on cultural competency and clinical care, and implicit racial bias is definitely one of the subject matters that was important, and the whole lecture series was to
yeah,
help the future medical providers to have to really be more quick to compassion versus judgment,
yeah.
and that's where the breakdown in communication and understanding and one's willingness to give others the benefit of the doubt and to treat people with more courtesy and so forth, because when providers are walking to the clinical encounter with preconceived judgments about the legitimacy of a patient's pain or their health concerns and things
Hmm.
of that matter, it begins to fall apart from there. And so it makes it easier to write a prescription or tell someone to get a over the counter pain reliever versus
Yeah.
giving them a prescription for one. And so so many things, barriers end up coming out of that when they are going into the encounter and lacking their understanding of the context of the lived experience of people of African American heritage and everything. And so it definitely makes it challenging.
I learned something the hard way. Before I take even an antibiotic, which is rare because I don't like medicine, if I don't if I don't need it, I'll look up to see what's in it. I look up to see is there anything in it that I'm allergic to, and it's possible. Does it have a very bad side effects? And then they'll tell me you have to take this. Okay, no, I'm going to take this because you have to be careful. I found that the person that helps people and they should use their expertise are the pharmacists. If I go into my pharmacist closed. My date is gone, unfortunately. So now there's CVS and Osley. So most of the pharmacists, most of the medical assistants are very good. So I walk in and go like, "Do I want to take this? Does it interact?" You have to ask questions.
Hmm.
You can't just take medicine because they said you have to take it. I have to know why. Is
Hmm.
there a reason? And they're so quick to prescribe Valium or Tramadol or any kind of opiate or any kind of muscle relaxer or any kind of destruct. Valium is just is like to calm you down. You don't want to take that if you don't have to. They're so quick to prescribe something, and doctors don't always. They just prescribe it. And they don't care, which is really sad. So there was a lot of research that went into this. How long did it take you to write this? Must have
Fran,
taken a while.
I initially started the research and presenting on this topic over 12 years ago. And
Yeah, I could see
it just continued to grow. So it
all of that.
wasn't a linear process, but it was just an accumulation of information over time that I finally gathered together uh, to create the book. But just a lot of medical presentations, and again the lecture series. A lot of the concepts in the book grew out of the lecture series I taught. And yeah, I mean, I visited Ghana, the slave castles, to understand a bit more at the beginning. I visited a slave plantation in the South, to just kind of get a better understanding, reading through a lot of slave narratives, and then, of course, just the public health research of contemporary statistics and understanding the impact of what all of this history is having on the here and now. And so all of the things that I list out in my book, Black Wellness Barriers, it provides a more comprehensive perspective. This book is unlike any other book that is out right now in regards to helping people to understand the chronic disease prevalency within the Black community, because it takes into account the historical dehumanization, transgenerational trauma, and structural racism that
Yeah.
out of that period of enslavement, and the impact that it's having on the lived day-to-day Black experience, and the stress, the chronic stress that it is causing. And so I don't stop there with just the horrors and everything, and the detriment of that, but I do provide, half of the book is dedicated to tools and strategies so that we don't get stuck there, that we create a better path for ourselves and the generations that are going to come behind us, so that they can have a better launching pad for their own health based off of the decisions that we get to make today regarding our health right now.
Also, I learned when I was teaching to connect with the nurse so that if I saw something in a class that somebody didn't look right, pink eye or a clot or something, some of the kids had sickle cell anemia that I work with, and they were in my reading group, and I didn't drop them in. I was just really careful. And you have to, people have to, nurses have to know what to look for. Teachers have to know what to look for too. And
Mhm.
kids have to understand that just because you have this or that doesn't mean that you don't deserve the help that you need. So, do you speak at different places, at different organizations to get the message out? Because this is an important book to get out.
Yes, yes, I do speak to community organizations and audiences, and churches and spiritual organizations as well, so that the information can become more widespread and people have more conversations about it. In addition to my book, I do offer a free reflection guide, because this book is one that you want to have conversations with yourself, in addition to with other people, to really process it, because it's better, and it ends up being able to be a lot more digestible when you're able to talk it through with other people.
So, what's next for you? What are you writing next? Are you going to write a sequel? Are you going to write more about this? First of all, I have to tell you, this is the first. I normally at the end I have about four doctors' offices. I'm not sick. They want the books. That's the only reason they tell me to come. And if I don't bring books, I can't come. No, for real, I'm serious. Between my ear, nose, and throat, my dermatologist, and my primary care doctor yesterday, they had a fit that I didn't bring some more books yesterday. I said, "You're lucky if I come at all to bring you anything." They want the books, but they're not getting this one because I find that there are parts of the book that I like to reread,
Yeah.
especially the last part with nutrition, and this part, educate yourself with trusted health resources. come prepared to appointments. That's the one thing that people don't do, that I'm a pain in the neck, and I do. When I speak to a doctor or whatever, I have it on my notepad. I come with questions that they, and you know what? You have to know if you're going for a specific test, you have to know what the test is involved, do you need it, and why. So,
Mhm.
where can we find out more about you and your work?
You can find out more about me at Black Cell, that's CELL, consulting.com. I am rolling out a variety of courses that are coming up soon that will be available, some self paced and some that will be available live with me. And so you can sign up to get on the newsletter to be informed about that. And follow me on LinkedIn and Instagram, Dr. T. Houston, ND, and find out more about what's going on with breaking these barriers and reclaiming health and wellness in the Black community.
This has been great. Let me go end this, Jane.